male who was receiving Ketovie 4:1 continuously through a G tube. This patient was having symptoms of neurologic bowel and delayed gastric emptying. Since transitioning onto Ketovie peptide, they no longer had to hold feeds due to slow motility. They maintained an excellent level of seizure control, and this patient also elected to continue with Ketovie peptide long-term. Next, we have an 11-year-old female who received a mixture of KetoCal, benoprotein, and Liquigen through the G tube. She required low volume feeds, so small but frequent feeds throughout the day, and she was being admitted to the hospital several times for aspiration pneumonias. Upon switching over to Ketovie peptide, they were able to tolerate larger volumes of feeds without vomiting. She also experienced a greater reduction in her seizures. Her large seizures reduced down to 0 to 3 per day. Ultimately, they ended up switching over to the regular Ketovie 4:1 due to constipation. And with that switch, she would have received a greater amount of fiber and a greater amount of MCT. So this was helping to manage her constipation. Next, we have a 9-year-old female who received a mixture of Ketovie, complete amino acid mix, and Liquigen. She was having GI intolerance with that mixture. And upon switching over to Ketovie peptide, she had an immediate resolution of those symptoms. However, there was no seizure improvement after 6 months of ketogenic therapy, so they elected to wean off of the ketogenic diet. Next, we have a 27-year-old male with traumatic brain injury who is receiving feeds of Ketovie 4:1. He was experiencing diarrhea with that formula, and so they elected to transition onto Ketovie peptide. There was improvement in the diarrhea, also with less bloating and flatulence. However, there was no perceived improvement from his TBI perspective, and so they weaned off the ketogenic diet. And finally, we have an 8-month-old male receiving Neo-K infant and complete amino acid mix plus oil. He was experiencing reflux symptoms, so they tried Ketovie peptide. However, he experienced an increase in reflux-like symptoms and ended up returning to his amino acid mixture after 3 days. So this is an example of a patient who likely truly required an amino acid-based formulation. And next, 10 months after Ketovie peptide launch in the US, we decided to survey ketogenic clinics to find out how Ketovie peptide was being utilized. After 10 months of launch, we found that 40% of clinics had tube-fed patients receiving Ketovie peptide. 16% had patients taking Ketovie peptide by mouth. 33% had added Ketovie peptide onto their hospital formularies. And the most common reasons for prescribing were a previous peptide or amino acid-based formula, GI intolerance, protein allergy or intolerance, and a patient in critical care setting. We'll next look at Ketovie 3:1. This is the latest ketogenic formula innovation from Ajinomoto Cambrook. It was launched in 2019 in the US. Ketovie 3:1 is the first and only liquid 3:1 ketogenic formula. It is nutritionally complete and contains 20% of the total calories from MCT. It's unflavored with no artificial sweeteners or flavorings. It contains both DHA and ARA. We added prebiotic fibers, FOS and GOS, that's fructooligosaccharides and galactooligosaccharides. It contains carnitine, selenium, and added citrates, and a bone health blend of vitamins and minerals. Ketovie 3:1 is designed for individuals over 1 year of age and is indicated for those who are able to obtain ketosis and seizure control at lower ketogenic ratios. This will provide greater convenience as there's no modulars needed for mixing. And this means less cost, less time, and reduced risk of mixing error. There's no artificial sweeteners for consumers who have concerns about utilizing those. And it's lower in calories than the other Ketovie options. And it's also higher in protein per calorie. Some similarities between our standard Ketovie 4:1 and the new Ketovie 3:1 is they both utilize the same 100% whey-based protein. They both contain MCT as well as enhanced amounts of carnitine, selenium, and citrates. They're both nutritionally complete and are indicated for those 1 and up, and they both contain DHA. Because we talk about the value to utilizing whey-based protein, I wanted to share this picture with you. This top row is showing a whey-dominant protein in an acidic environment, simulating what would happen in the acidic environment of the stomach. And you can see that that whey protein stays aqueous, and so it's able to empty out of the stomach faster, potentially reducing symptoms of reflux or challenges with delayed gastric emptying. You can compare this with a casein-dominant protein, which is again put in the acidic environment, but casein protein will coagulate, and those coagulants must be broken down into very small particles before it can be emptied out of the stomach. So some key differences with Ketovie 3:1 compared to the 4:1 formulation is, of course, the lower ketogenic ratio. There is slightly less MCT. There's 25% in the our standard Ketovie 4:1 and 20% in the Ketovie 3:1. It's less calorically dense at 1 kcal per ml or 30 calories per ounce. There's no artificial colors or sweeteners used. We added the prebiotic fibers, FOS and GOS, for GI health. It contains both DHA and ARA, which are important for brain and eye development. We also added taurine, which is a conditionally essential nutrient important for brain health and fat absorption. And we also added inositol, which is a nutrient that can be found in breast milk and is important for brain development. Here we have a side-by-side comparison of all the Ketovie formulas. Notably, under calories, you can see that Ketovie 3:1 is much lower in caloric density. Because of the lower ketogenic ratio, this affords more room for protein. So the Ketovie 3:1 has more protein per calorie. It contains 6 grams of MCT per serving. Again, both DHA and ARA. The carbohydrate amount per calorie is just slightly more, again, because of the lower ketogenic ratio. The fiber content is less, and there's no sweeteners included in the Ketovie 3:1. In the 2018 International Consensus Statement on Ketogenic Diets, it was recommended for young children and infants that they be put on a 3:1 ketogenic ratio to prevent low blood sugars, reduce acidosis, and promote optimal growth. There's also a growing trend among ketogenic clinics to utilize the lowest possible ketogenic ratio to achieve seizure control. And this is to lessen side effects and provide a more nutritionally complete diet. Also, patients with low calorie needs often struggle to meet their protein needs. And so by providing the Ketovie 3:1, we were able to optimize the protein content. And a little bit more on FOS and GOS prebiotic fibers. GOS, that can be found in breast milk, feeds the bifidobacterium in the gut, which can stimulate the immune system maturation and gut barrier function. In children and adults, FOS prebiotic fibers has been found to be fermented efficiently in the gut, so leaving very little residue. And the benefits to providing both FOS and GOS together is that they promote growth of beneficial bifidobacteria. They have a positive immune response with antimicrobial effects. It's suggested to improve calcium and magnesium absorption, improve stool characteristics, and may reduce allergenic manifestations and infections in the first 2 years of life. So overall, Ketovie 3:1 is a nutritionally complete 3:1 ketogenic formula. It is unflavored. It utilizes 100% whey-based protein, contains 20% of the total calories from MCT, contains DHA and ARA, is supplemented with additional carnitine for fatty acid metabolism. It is low in fiber, low lactose, no artificial sweeteners, and contains Foss-and-Goss prebiotic fibers. There is a vitamin and mineral blend for bone health, and it also contains citrates for the prevention of acidosis. We also did an early experience trial in the US with Ketovie 3-to-1, again breaking this up into patients who were new to ketogenic therapy and those who switched from another ketogenic regimen. First, we have a 1-year-old female who was fed Pediasure at baseline. She had low energy needs and a history of constipation. So they were able to meet the 3-to-1 ratio goal with Ketovie 3-to-1 without an added modular. She met her protein needs and vitamin and minerals, and she got the MCT to help with constipation management. So this patient achieved ketosis at a 3-to-1 ratio and has had no noticeable seizures since achieving ketosis. Next, we have a 7-year-old female who was fed via G-tube with Pediasure. She had a history of reflux, vomiting with feeds, and constipation. The goal of a 3-to-1 ratio was able to be reached without adding a modular. There was no vitamin and mineral supplements needed. She achieved ketosis at a 3-to-1 ratio, reported improved alertness since being in ketosis, and her tics, which were presumably seizures, resolved. There were no reflux, emesis, or constipation symptoms. Next, we have a 5-year-old male who was being fed via G-tube with the standard casein whey-based formula. And this patient had a history of constipation. They desired the convenience of a ready-to-feed 3-to-1 ketogenic formula that contained MCT. And Ketovie 3-to-1 met 100% of this patient's micronutrient needs and protein needs. This patient ended up achieving ketosis at a 2-to-1 ratio, and his constipation was well managed. In our established Ketovie patients, our first is a 5-year-old male who was receiving a mixture of Ketocal 4-to-1 powder mixed with Pediasure 1.5. They were reporting challenges with clumping of the formula powder, also acidosis that required sodium bicarb supplementation, and constipation requiring daily Miralax. The family desired a ready-to-feed ketogenic formula option, and they switched to Ketovie 3-to-1 for the convenience of no mixing. They maintained a good level of seizure control. Bowel movements were regular and formed. They were able to discontinue the Miralax. The bicarb level also improved, so they came down on the amount of sodium bicarbonate supplementation, and they began weaning off some of the anti-epileptic drugs. Next, we have a 5-year-old being fed by G-tube, a mixture of Ketocal 4-to-1, cornstarch, beta-protein, salt, and water to a 3-to-1 ketogenic ratio. He was also getting a daily multivitamin and had a history of constipation. The Ketovie 3-to-1 offered more protein and vitamin and minerals. It met the patient's needs. He was able to discontinue the protein modular as well as the multivitamin. And the MCT was seen as a benefit to help manage his constipation. He maintained ketosis when he switched to Ketovie 3-to-1. He's had no noticeable seizures, and he's having regular bowel movements. And next we have a 20-year-old female who was receiving a ketogenic diet via G-tube. They'd been switched over to a soy-based modular ketogenic diet, which included MCT oil in order to maximize the ketogenic ratio, which was 3-to-1. The patient was having increased seizure frequency, and this was thought to be related to multiple caregivers preparing the formula and possible mixing error. So they wanted to provide a nutritionally complete, ready-to-feed 3-to-1 formula to simplify the dietary regimen and reduce possible error in mixing. When they switched over to Ketovie 3-to-1, she had stable seizure control with that transition, including new periods of seizure freedom up to 2 weeks. The formula was well tolerated. The MCT content was similar to what they were getting in their modular regimen for constipation, and they were able to meet protein needs without an added modular. And that completes our current Ketovie line of formulas. Here are some of my references, and I thank you for your attention.